So, Dr. Lachman at Cool Dental, let's talk about tongues. Anytime I can have a giraffe in one of my videos, I'm going to do it. When your child is swallowing, the normal way to swallow is that the tongue goes to the roof of the mouth, right behind the upper front teeth. That little bump behind the upper front teeth, that is the target. Your tongue should go up to that little bump and then force the food back down your throat and swallow. That is normal swallowing for adults. That's normal swallowing for children. Sometimes babies, you start with an infant swallow where the tongue comes a little bit more forward. That helps with the breastfeeding and such. But when the child is done breastfeeding and on to regular foods and drinking normally, the tongue should then change from a tongue forward swallow to a tongue up and back swallow. Some people keep that tongue forward swallow. We actually call it a tongue thrust. So when people in their late teens and even adults, when they swallow, their tongue is coming forward, that is not correct. What ends up happening is then the tongue is constantly coming forward and the upper and lower teeth cannot grow together, and then you end up with an open bite situation. When they smile, the teeth are not overlapping, there's a gap. That's usually due to a tongue thrust situation where the tongue is always going forward. Best to catch this when it's early. Sometimes there's problems with tonsils and adenoids. Sometimes we have to send children to the ear, nose, throat specialist. Sometimes we just simply have to work with the child to retrain them about how to swallow properly. But either way, if your child is swallowing with a tongue coming forward, that needs to be looked at as soon as possible, because otherwise there will be major orthodontic problems to try to be corrected later on. Thanks.